welcome to Health Screen. We're fortunate to have Associate Professor William Kemp, who is one of the leading liver specialists in Australia. William is a senior lecturer at Monash University and staff specialist at the Alfred Hospital. Welcome to the program.
Thanks very much for the invitation, David.
Well, I wanted to talk to you about liver health. And there's a number of questions that our viewers want to know. I guess probably what I'd like to start that I understand there's an epidemic of fatty liver disease. What is it, and should we be concerned about this?
Yeah, it's a good question, and you're quite right. There is an epidemic of fatty liver disease. What fatty liver disease it represents is fat being deposited in the liver. And we actually have a definition for that, defining that as greater than 5% of the liver cells having evidence of fat. And if we look at the overall population in Australia, it may be around about 1 in 3 adults actually has evidence of fatty liver. Fortunately though, for the majority of those people, it doesn't have significant health implications. But for whatever reason, in a minority of those individuals, they may actually be at risk of developing progressive liver disease.
How do we diagnose fatty liver disease?
So I guess the most established way to diagnose it is with the liver biopsy, but that's not practical when you consider the vast numbers of people that might be affected by fatty liver. Ultrasound is another technique, and ultrasound can detect evidence of fatty liver by the changing picture that you see with ultrasound, but that's not particularly sensitive. So that can pick up the fatty liver when there's lots of fat in the liver, but at more minor amounts of fat in the liver, you may not notice that on ultrasound. There are blood tests that can also give doctors a clue, and there are some new techniques using ultrasound sort of techniques which can help diagnose liver disease as well.
You've mentioned that there's very few people with liver disease actually develop complications. So what are the complications? How can we judge who's going to develop liver disease and who isn't?
Yeah, it's a really good question. And I think we're battling with that now as health professionals and trying to give guidance to general practitioners and the allied health professionals that work in the area about who they should be worried about, who they should refer on to further investigate, and who perhaps can just be reassured. So as I said, the vast majority of people with fatty liver, it doesn't have health implications for them, but in the minority they might develop liver inflammation, and the doctor might notice that by doing the liver function tests, which can show that level of inflammation. And our most concern is for patients who actually develop scarring in the liver as a result of that inflammation. And again, there may be some blood tests that can give an indication for that. We may see some changes on some of the liver imaging, like ultrasound or like FibroScan, which can detect some of that scarring. And only in its most severe form do we see significant clinical complications of liver disease. And that's where patients may develop a change in colour, they may go jaundiced or yellow, dark urine develops, they may have trouble with their fluid balance, so swelling of the ankles or swelling of the abdomen. And I guess in the most severe form develop liver failure with confusion, bleeding complications. And also one of the other concerns we see is an increased risk of liver cancer developing in that population.
How common is fatty liver disease in Australia? You mentioned I think 1 in 3 people may have fatty liver disease.
Yeah, we don't have really good data from Australia. So a lot of the information that we do get about the epidemiology of fatty liver is actually extrapolated from other populations. So we estimate around about 1/3 of adults will have evidence of fatty liver, but the rate increases proportionate to various risk factors. So we know in patients who are overweight or obese, they have a higher rate of fatty liver. And fatty liver itself probably sort of sits within the metabolic dysfunction that we see in association with type 2 diabetes, high cholesterol, hypertension, obesity. So patients with those type of risk factors also have a higher frequency of fatty liver.
Well, you've done a considerable amount of research in the area of fatty liver disease. So what is the treatment for fatty liver disease?
So there's lots of groups looking and exploring and trying to validate the various treatments. But what we understand at the moment is the most effective form of therapy for the vast majority of people is weight loss. And people have looked at how much weight does someone need to lose to actually make a difference for their fatty liver. And it looks like somewhere around about 5 to 7% of total body weight seems to be enough to actually produce what we call a histological improvement. So if we were to biopsy the liver, we'd actually be able to measure and see a difference in the liver biopsy. So that might be less than some people think. If you're weighing in at 100 kilograms, then getting the weight down to 95 or the low 90s might be enough to have a clinically meaningful improvement in liver health.
Well, what about, are there any pharmaceuticals or any medicines that can be used for fatty liver disease?
Yeah, there's lots of drugs currently under development specific for the treatment of fatty liver, but none of them are currently available and none of them are proven to be effective. We do know that modifying the various risk factors for fatty liver. So, for example, if a patient has type 2 diabetes, then improving the diabetic control can have a big impact upon fatty liver. And there are some drugs being used for type 2 diabetes, such as a class of drugs called the GLP-1 analogues, which promote weight loss and may also have a very specific effect on fatty liver. So that might be something that we watch in the future. But there are lots of drugs currently also under development that I guess we're all hoping will also have a positive impact upon fatty liver.
Very interesting. I think obviously this is an area which has been expanding very rapidly, and our realization as how significant fatty liver disease is in causing scarring, cirrhosis of the liver, and potential contribution, as you said, to the liver cancer. I wanted now to talk a little bit on other areas in terms of liver health. Obviously, the obvious question is alcohol, and what our viewers, want to know is, what is the safe amount of alcohol? Is it different between men and women? Do we need to have an alcohol-free day? What are your thoughts on that?
Yeah, it's a good question, and we're fortunate that relatively recently the National Health and Medical Research Council have come out with updated guidelines regarding what they consider to be safe alcohol consumption. And what the results of that are a recommendation that both men and women drink no more than 10 standard drinks in any 1 week. So that's a bit less than 2 standard drinks a day. And that's tightened up from the previous recommendation, which was up to 2 standard drinks a day. We also recommend that whilst it's 10 standard drinks a week, those 10 can't happen all on the one night. So the frequency of drinking also makes a difference. So really no more than 4 drinks at any one occasion, but no more than 10 across the entire week. And what people consider to be a standard drink also varies, and people might be surprised at a standard drink is 30 mils of spirits or 100 mils of wine or 285 mils of beer. So in your average stubby, there's a bit more than 1 standard drink, and in most people's glasses of wine is more than 1 standard drink. So I tell my patients that, remember, a bottle of wine is around about 8 standard drinks. So a bottle of wine really should almost last you a week.
Very, very interesting. I wanted to talk to you a little bit about, as you know, this is probably about health and longevity, and obviously you're very attuned to your own health. What do you do for health and longevity? Do you exercise? Do you follow any specific diet?
Yeah, I guess for a long time I haven't followed any specific diet, and to be honest, did minimal exercise. But more recently, I've taken a much more interest in my own health and tried to improve my diet, so less eating out, more fresh vegetables, fresh meat, and also improved the amount of exercise I'm doing. So trying to do at least half an hour of exercise a day. And I think for me that's made a big difference. It makes me feel better. It's improved my concentration, improved my sleep, and result in some weight reduction.
Well, in terms of exercise, is there any particular form of exercise that you think would be more beneficial than others? I think you mentioned that you do exercise, the cardiovascular exercise, is it weights?
Yeah.
And also a related question with the diet, any particular diet, is it Mediterranean diet, is it intermittent fasting, do you follow any particular diet?
I think it is difficult to give a blanket recommendation, and it depends upon what people want to achieve. I guess what I tell my patients is that diet is the way to lose weight. Exercise is a very inefficient way to lose weight, but exercise has a lot of other health benefits in terms of improved muscle strength and improved balance and improved cardiovascular health and decreased blood pressure. So there's lots of reasons to exercise, but to exercise for weight loss is actually quite inefficient, and diets is much more efficient. So if we're trying to achieve weight loss, and maybe if we go back a step and think more about our population with fatty liver who often overweight or often have other cardiovascular risk factors, and we want to encourage them to lose weight, then trying to get them to reduce the amount of calories that they take in is a really important part of that process. And that might be even getting patients onto those very low calorie diets, very low energy diets to achieve some weight loss, and then using a dietitian and using expert advice to establish a maintenance program. We understand that disease processes like obesity are a chronic health condition. They don't go away just because someone's lost weight. They need ongoing maintenance to keep that weight off.
Very, 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 very enlightening. I wanted to talk to you about liver health in general, and also you obviously see in the media various liver cleansing diets, liver detox diets. What are your thoughts on those things? And also, I guess, is there any scientific basis or evidence-based medicine which supports those claims?
It's a huge industry, and as you know, David, patients are very interested in these products and whether they do produce any significant benefit. The data doesn't seem to suggest that they produce any meaningful clinical benefit, and certainly from a liver point of view, your liver doesn't need that extra help in terms of detoxification. That's one of the key roles of your liver, is to detox substances within the bloodstream and the substances that you might eat and absorb from the intestine. And the liver is very capable of doing that without the assistance of any of these medications. So they have been looked at. There's no data to suggest that they make any meaningful difference to the liver function. There are some components of some of these products like silymarin, like turmeric, which are commonly used to promote liver health. And there is some suggestion that they might have some antioxidant properties. They may even have some anti-fibrotic properties. But when it's been looked at in fibrotic conditions like hepatitis C or alcoholic liver disease or even fatty liver, they don't seem to produce any significant difference. So my advice to patients is, look, if they make patients feel better, then there doesn't seem to be a harm associated with them. But I caution patients that, I wouldn't want to see patients spending large amounts of money on unproven therapies.
Well, one of the questions I wanted to ask you is, we know what's bad for the liver, what are the toxins we shouldn't be taking. Are there any nutrients that are of benefit to the liver? What should we be eating more?
Yeah, again, it's a good question, because again, people are really interested in that, and I think we often tell patients that they shouldn't be doing these things, they shouldn't be doing that, they shouldn't be drinking as much, and they should be losing weight. But I guess some good news for the coffee drinkers is that there is some good evidence about the benefits of coffee intake on liver health, in particular with regards to fatty liver, but maybe also with regards to a reduction in the amount of scar tissue, and potentially even a reduction in the amount of liver cancer. The other really interesting thing about the coffee story is that it seems to be continuous with how much coffee you drink. So the more coffee people drink, the better. I guess the downside is it doesn't apply to a sort of a weak latte with full cream milk and multiple volumes of that. So it is actually the coffee substance. So probably sort of more the espresso style seems to be better for you than a particularly milky coffee or coffee that's got lots of sugar in it. But I think it's something that we can say to patients that are coffee drinkers is that it's something you don't need to cut back on.
Oh, that sounds great news for me because I've had about 5 cups of coffee today, but I think I should change to this espresso. Now, chocolates go with coffee. Chocolate's bad for the liver?
Chocolate is not necessarily bad for the liver, and in fact there's good data about health benefits, particularly for dark chocolate. So good quality dark chocolate may have actually really positive cardiovascular benefits. It may result in improvement in cholesterol, which can have flow-on effects to the liver. So again, it's not a bad thing, and in moderation, it may in fact be helpful.
Well, I'm modifying my diet now to espresso and dark chocolate.
Enjoy.
Well, I wanted to talk to you about health, as I mentioned, and longevity. And one of the things that I ask all my guests is about 3 tips for health and longevity, and maybe additional tip for liver health.
Yeah, it's a search for the Holy Grail, isn't it? I wish I had the answer just to sort of present to you. So I don't know. I mean, I guess thinking about those things about health and longevity, body health and mind health, I think the 3 things that I can think of, balance being one of them. So trying to live a life of balance, and that applies to people's diet, people's family relationships, people's work-life balance. Avoiding excesses, but there's no need to also self-deprive. So trying to strike that sort of balance, I think, is one thing that people can do to improve their overall health. I think staying curious, having a life of learning, being interested in what other people are doing, being interested in the world around you is a really important part of staying fresh, coming up with new ideas and staying young. And I guess something like purpose, finding a purpose in your existence. That might be something to do with work, it might be something to do with family, but having a purpose to your day, I think, is really important and probably goes a long way just to overall happiness.
What about any specific tips for liver health?
I think the liver's natural state is one of regeneration. So the first thing to do is to not overstress the liver. So that's avoiding toxins, particularly like alcohol, too much alcohol, some medications which can be toxic to the liver. So avoiding things that are going to stress the liver out. That's the first thing. The other thing is maintaining a healthy weight. Again, we've cut back to the fatty liver epidemic. So being able to maintain a healthy weight is also an important aspect of overall liver health.
Will, thank you very much for your time. It's been very educational, very entertaining, and I look forward to hearing more from you.
Thanks very much, David.